can screenshot, take a picture and send it to me. That would be memorable for myself too. But if you don't know me, I'm Mark Bai. I have been your president for the past year here. And I want to thank you all for joining our swearing in ceremony tonight for our incoming president and the officers for San Bernardino County Medical Society for 2020 to 2021. So this is our virtual or Zoom version of the installation of officers. We usually would hold this at somewhere in San Bernardino County. This year it was supposed to be at Red Hill Country Club, but either way, this is my last official gathering as your president before I turn over the reins to Dr. K Tsai here. I want to thank everyone for making it an incredible and a memorable year, to say the least. I will never forget this experience, as I'm sure many of you will not as well. But before we begin, I want to express our gratitude to a couple of our very important sponsors, and they have actually joined us here as well, and they make much of our work and outreach possible here at the Medical Society. So let's recognize NORCAL Insurance Company, represented by Brad Duncan. So Brad, if you want to wave. And if we all want to give them a virtual thank you for your support.
And we've got Belinda Ramon from NORCAL with us too.
All right. Hi, Belinda. Thank you. Thank you for being here. And they continue to work side by side with our Medical Society to provide medical malpractice insurance, as well as one-on-one guidance and innovation. And this year they've taken the partnership to a new level through additional sponsorship of our Medical Society for COVID-related activities for our physicians, and that has enabled us to provide relief for physicians that would not otherwise be possible. And they have provided SBCMS with our very first wellness grant, which we plan to implement as soon as we safely can. So thank you very much. Let's also recognize Mercer Insurance, and they are represented tonight by Frank Blackwell and Liz Fogel. So please wave. Frank and Liz. Hi. So thank you. We'll give you a hand as well. Thank you. You've been our continual partners in offering CMA insurance programs to all members, ranging from workers' comp to health to travel to retirement to benefit plan administration. And Mercer's portfolio, which is customized for SBCMS and CMA, helps physicians completely redefine their practice model and operational approach, resulting in significant savings and return on investment. Frank and his team are welcome and welcome faces at many of our events, including our Zoom event here, and they've always been available to lend guidance to our physician practices, and they work closely with our Medical Society in developing tools that advance their practice. So thank you once again to Mercer and NORCAL. You are good friends to us and outstanding partners. The second half of this year, so the first half was pretty normal, but the second half, which has been the first 6 months of 2020 here, has been very memorable and interesting. It's been unprecedented in the way we do business and in the challenges we face as a medical community. I am proud and privileged to be the president at this time when this support and structure has been needed more than ever before. I truly believe in the constant, in the midst of unpredictability and change, our Medical Society has proven that all change is not bad. We've provided a uniform platform to assist physicians with everything from obtaining personal protective equipment for our solo and small member practices, just providing step-by-step guidance on how to establish a brand new telehealth model, to ways to open re-office doors for SCIDS patients. So we were honored as a Medical Society to be involved with our San Bernardino County COVID Task Force here. And I know Dr. Aaron Gustafson could not be here with us today, but just partnering with our acting county public health officer, and that's just encompassed a valuable collaboration with that department. We've also continued to work closely in tandem with our CMA for some sweeping accomplishments, including reform reimbursement structures for telehealth, the establishment and reinforcement of waivers to continue full patient care while ensuring parity for physician reimbursements, statewide public health collaboration and testing mandates that impacted us here locally, as well as lots of work with the governor's office and regulatory agencies that have, in many cases, determined the survival of some of our groups and practices here in the county, and the continued access to care for patients who need it most. We've also, if you remember early on, we partnered with Riverside County Medical Society, and our executive committee knows about this. Back then when masking was not in the picture in California, we partnered with the Medical Society to help bring that forward to CMA, and I believe within a week's time, we saw something come out on the guidance on masking here in California. So our Medical Society has played a really big influence on some of the very positive things that have happened not only here in our county, but also in our state. We've also rallied in a big way with our state level legislators to push for the protection of Prop 56, which was successful. And that was the whole Cal Healthcare's loan repayment program. And it resulted just recently on June 15th, where the state budget was passed, and it rejected, which would have been many of the devastating cuts to the Medi-Cal treatment and reimbursement for many of our practitioners. If you remember, we fought for that very strongly before, and we had to fight for it again. And again, that's the power of organized medicine, and you all here joining with us. We continue to be heavily involved with our ancillary programs, including our 2 nonprofits, which support student and resident programs, as well as the Southern California Medical Museum, along with prominent involvement with the Inland Empire Opioid Crisis Coalition, the County School Nurse Collaborative, and the Inland Empire Coverage and Health Initiative, which we chair as SBCMS. We've also established our first mobile app for SBCMS, and make sure you've tested it out if you haven't already, which is also a first for any component medical society statewide, and it will soon be available as a download on Google and Apple stores. So tonight, as we really celebrate our successes and the shining example, the way we work together when times are at their most challenging, we are thrilled to have our president-elect of the California Medical Association, Dr. Lee Snook, here with us to conduct the official swearing in of our president and our officers. So if you don't know Dr. Snook, I'm sure many of you do already, but since 1992, he has been so dedicated to the growing field of pain medicine. He's been recognized and a respected advocate for its advancement. He's the president and the founder of Metropolitan Pain Management Consultants in Sacramento. He's board certified in internal medicine, anesthesiology with subspecialty certification in pain medicine, and is board certified in pain medicine, and is a diplomat of the American Board of Addiction Medicine. That's quite a mouthful, Lee. I don't know how you get all that out in one sentence, but he has been a member of the CMA since 1985 and a member of the House of Delegates since 1992. He has served as chair for the Workers' Compensation Medical Evidence Evaluation Advisory Committee and the CMA represented to the Division of Workers' Compensation, the MEEAC Chronic Pain and Medical Treatment Utilization Schedule as a subject expert for chronic pain. He is also the recipient of the prestigious 2050 Carrie Nevins Community Service Award for Northern California. He served for 3 years as our Vice Speaker of the House of Delegates and 3 years as Speaker. And most exciting, he is currently the President-elect for California Medical Association. And he is set to take his position in late October following this year's virtual House of Delegates. So with that, welcome Dr. Snook, and I will pass over the floor to you.
Thank you. Thank you, Mark. I'm so happy to be here with all of you tonight, especially since I was already planning to be at your installation in person this year with my lovely wife, Cindy. We've actually attended the past several installations for the San Bernardino County Medical Society, and I feel a special connection with SBCMS. I've had the opportunity to work closely with some of you as physicians, as well as in leadership roles through the California Medical Association's Board of Trustees and House of Delegates during my role as Speaker and in numerous committee and task force positions. The San Bernardino physicians are special to me. You embrace a special kind of vision and integrity, allowing you to balance the needs of each and every patient, as well as keep an eye on the importance of advancing through the CMA structure, which will enable you and the SBCMS to influence the way healthcare is delivered in our glorious state of California. The CMA needs and values your voice. I've always been proud of the kinship with all of you and your medical society. In my last year as Speaker of the House of Delegates for the CMA, I was beyond delighted to designate and present the annual Speaker's Award to Dr. Thelma Cortman, a singular honor that I get to do as Speaker. Nobody gives me any crap about it. I get to choose who it is, and that's what I did. And this year, I know that Dr. Eric Hansen has just thrown his hat in the ring for Vice Chair of the Board of Trustees, which makes this an even more exciting time and the type of influential representative that SBCMS can achieve at a statewide level. Your incoming president and officers are the prototype for what physicians should be. I'm so very honored that you have asked me to swear them in for their executive committee positions for the upcoming year, starting July 1st, 2020, and continuing through June 30th, 2021. So let's get started. In you is invested the responsibility and authority to lead the medical society in all its endeavors. It is for you to hold aloft the principles of the San Bernardino County Medical Society. By your example and by your efforts, the society can falter or advance. Your position is a precious privilege and a great responsibility. May you go forth with extreme clarity of mind, forthright qualities of leadership, broad vision, and an unswerving dedication. You are now duly installed as the officers of the San Bernardino County Medical Society for 2020/2021. Let me personally congratulate each officer. President Christopher Shai, Partner San Antonio Medical Group, President-elect Kristy Roloff, Maternal Fetal Medicine Specialist, Valley Obstetrics and Gynecology Medical Group, Arrowhead Regional Medical Center. Vice President Javier Sanchez, MD, Family Medicine, Southern California Permanente Medical Group, Redlands. Secretary Tarek Moqattash, Internal Medicine, St. Joseph Health. Treasurer William G., MD, Family Medicine, Loma Linda University School of Medicine. Immediate President Mark Bai, MD, Family Medicine, Southern California Permanente Medical Group, Fontana and Ontario. Congratulations, and let's have a round of applause. Well deserved. Dr. Shea, would you please say a few words?
Thank you, Dr. Snook. It's an honor to have you recognize and install our 2020-2021 officers. We're grateful for your leadership at CMA and excited for your term as president.
Thank you.
A name you did not hear sworn in for the first time in 5 years is Dr. Raja Sekar, who has concluded his term on the executive committee. Raj, you've been a catalyst for so many projects and policies we couldn't possibly list them all. Thank you so much for your service, and as you continue on at CMA, please know that we're going to continue to call on you for your local knowledge and skills. A big thank you to all our past presidents as well, who have devoted their time and skill to build this organization. COVID-19 has upended our lives, personally and professionally. The impact has been sudden and tremendous, and we're going to have to live with it for the foreseeable future. We as physicians must continue to adapt. As Mark mentioned, CMA and SBCMS have been providing timely webinars and resources to help practices navigate this new landscape, adapting to telemedicine, virtual care, providing PPE, and doing public service announcements to encourage patients to resume routine and preventive health care. We're going to continue to look for ways to adapt, obtain relief, and provide assistance. In addition, we will support and stand by our public health department and their efforts to keep the public safe. As our interactions and social presence become more digital, it's critical that our technology keep step. And for that, I'm grateful for the ongoing work of Dr. Moqattash and Dr. McDonald with the SBCMS mobile app. Together, we've rallied against Governor Newsom's attempt to divert Prop 56 funds from this year's budget and protected the Cal Healthcare's loan repayment program. As long as there's a deficit, we can expect this fund to be a constant target, and we need to remain vigilant. In addition, we still face a micro challenge, which, although it was pushed off of this November's ballot, will be just around the corner in 2022. We're already preparing, it's not too early, and only together as an organized voice are we going to defeat this measure. Some good news, we learned last week that we've been named as a partner with First 5 San Bernardino in a grant to educate and communicate the elements of ACEs Aware. It's a campaign surrounding adverse childhood experiences. And there are also some really encouraging things happening in the value-based care space. SBCMS and CMA have partnered with Aledade and the CMA's Physician Services Organization to help our practices realize dramatic shared savings for both Medicare and fee-for-service models. Despite all of the challenges that we face, what keeps me going is knowing that we make a difference. We make a difference as individual providers, as solo, small, and large group practices, and as a county society. We are role models. We've taken an oath in which we have sworn to care for every human being entrusted to our care, period. As our country continues to struggle with race, perhaps what we do can be an example. We're by no means perfect, but we factor race into every patient encounter. It's part of our differential diagnosis. It's programmed into our EMRs. We can't ignore it. In fact, it would be considered malpractice in some cases where we did not consider a patient's ethnic background as it pertains to their risk for disease or how they might respond to treatment. A person's race, though, is just an observation and not a judgment. We've been trained professionally to see each patient as a whole so that we can care for them in the best way possible. It's not a bad way to see people on a personal level as well. To the executive committee, board members, Med Society members, and medical society staff, thank you for giving me this opportunity to serve you. I need your ideas, your input, and your service. And for that, I thank you for your participation in SBCMS and for your sacrifice and dedication to your patients every day. We are stronger together. Our first Zoom meeting will be this July. I'm asking that the executive committee please stay with this after this meeting so that we can discuss one issue. And lastly, I want to thank and congratulate Mark Bai for an incredible job this past year. You have been a rock and leave behind a very high bar for those of us following in your wake. No one could have seen the challenges thrown upon us 4 months ago, and you have met every challenge head on, willingly and without hesitation, and with crystal clarity. So on behalf of SBCMS, I have this crystal rock to give you, which reads, in recognition and appreciation, Mark Bai, MD, 127th President, 2019-2020, San Bernardino County Medical Society. And I found that it works perfectly for storage. Thanks, Mark.
Thanks. I need one of those. Yes, thank you. Very good. So, yeah, I think that sounds like that's about it, for tonight. I think we just wanted to keep it short and sweet. And I know we'd like to be celebrating differently, but it's great that we at least have an opportunity to do this. And it's great to see everyone on the call. I want to thank you for joining us. Thank you, NORCAL and Mercer again. Thank you, Dr. Snook, for your time and for your words to swear in our officer. And congratulations again to Dr. Christopher Tsai, our new president. We look forward to a wonderful year under your leadership. And with that, I wish everyone a great evening.
Thank you, everybody. And
Thank you.
executive
Thank
committee,
you.
please stay by.
Thanks, Mark.
Congratulations.
Thank you. Thank you so much. Thank you, everyone.
Thank you.
Congratulations.
Right now.
Thank you, Dr. Snook.
Bye-bye.
Congratulations.
Congratulations, Dr. Tsai and the team.
Thank you.
Thank you.
And thanks to Dr. Mark Bai for our support of the organized medicine.
Thank you.
Mark, am I out?
Community service. It's a
Thank
good
you.
job with all this, a lot of uncertainty.